For this assignment, I'm going to be discussing Rett syndrome. Rett syndrome is a genetic neurological and developmental disorder caused by a mutation in the MECP2 gene on the X chromosome. Infants with this condition develop as expected for about the first 6 months of life, and they're meeting those developmental milestones, and then progressively they start to lose those skills that they've developed. Typically, children lose their motor skills and language skills first, and then many children end up experiencing seizures and intellectual disabilities as well. And typically, children will develop non-functional repetitive hand movements, whether it's clapping, tapping, or maybe a similar movement to a tremor. And Rett syndrome primarily impacts females because males have a different chromosome combination than females. So males who have the genetic changes that cause Rett syndrome are affected in a devastating way, and most of them die before birth or in early infancy. There are 4 stages of Rett syndrome. The first stage is early onset from 6 to 18 months old. During this stage, symptoms are often overlooked, and this is when parents begin to see that their child may be showing decreased eye contact or losing interest in toys that they were frequently playing with before. They might not be meeting that developmental milestone for sitting or crawling, and then this stage lasts for a few months to a year. The next stage is rapid deterioration from the ages of 1 to 4 years old. Children during this stage begin to have slowed head growth. Those abnormal hand movements start to become really apparent, and many children have multiple behaviors in an attempt to communicate. So some children might be screaming or crying, hyperventilating, just very distressed. And then in stage 3, we get to the plateau, which is from the ages of 2 to 10 years. Any problems that the child was having before with movement continues to progress. Their behavior may improve, less crying and irritability. And then some children begin to have seizures, and these typically don't start until after the age of 2. The final stage is the late motor deterioration stage from 10 years up. During this stage, children experience reduced mobility, muscle weakness, joint contractures, or scoliosis, and then typically we'll see the seizures start to become less frequent. The first source that I read was a blog written by a woman named Gabby. In her blog, Gabby wrote that she feels her mind is trapped in her body, which hinders her communication abilities. She also said that despite her appearance, she is very intelligent and has learned to type. In the blog, Gabby mentioned that she experiences challenges with brushing her teeth, dressing, mobility, and her mom has to help her with a lot of these activities. She longs for independence in these areas, and others she would like to move out, and she does not want to be reliant on her mom for her entire life. She also went into detail about how this impacts her ability for social participation. On the left, I put a little snippet of a part of her blog that I thought was really important for understanding Gabby's perspective of how Rett syndrome has impacted her life. In the documentary that I watched, it followed the life of Millie, who is a 9-year-old girl living with Rett syndrome. The documentary went over her regression and how she went from a typically developing baby meeting those developmental milestones to experiencing symptoms of loss of babbling, difficulty maintaining eye contact, and eventually loss of her mobility. As a family, they experienced confusion and misdiagnosis as those early symptoms mentioned above were neglected by her care providers, and the family was told that she seemed fine. After the diagnosis, the family had to make multiple adaptations to their home environment and their transportation methods to accommodate Millie's changing needs. She was wheelchair bound, so Millie's mother went out and found a van that was wheelchair accessible and was able to lift Millie in and out of the van. And then the documentary went into Millie's experience as well. She regressed from feeding herself, holding a book, and drinking independently to needing all of those things done for her. She relies heavily on her mother. However, she does attend a therapy school where she's learning how to use an augmentative and alternative communication device, and she participates in horseback riding and pool activities to support her enjoyment and engagement in life. Lauren is a 19-year-old girl who was diagnosed with Rett syndrome when she was an infant. She uses a wheelchair to get around. She uses an AAC for communication, and she relies on her family's assistance for self-care tasks and daily necessities such as feeding and hygiene. Unlike Gabby and Millie, Lauren developed multiple comorbidities of Rett syndrome. So she has a healthcare team that her family has recognized as great support. And as you can imagine, having this many providers on a healthcare team must mean that she has had to go to a lot of appointments, so her and her family have had to adjust their schedule, and it has impacted their social participation quite greatly. There were many takeaways from each of these children's experiences. So just to reflect, from Gabby's blog, the key takeaway that I thought was the importance of recognizing intellectual potential and providing space and opportunity for children who are preverbal and or nonverbal to communicate, whether that's through assistive technology or other methods. In Millie's documentary, it helped me understand what a regression may actually look like for someone with Rett syndrome. And then from Lauren's experience, it really helped me to understand how impactful the comorbidities of Rett syndrome may be on children and their families' lives, and how these comorbidities can really exacerbate the amount of support that the child may need. From these experiences, in future practice, OTs need to be aware of signs of aggression. That way they can tailor interventions effectively, advocate for early intervention services and screening, collaborate with families. That way we can understand the child's pre-diagnosis abilities, be adaptable and flexible to change sessions and goals as the child's condition progresses, collaborate with speech pathologists and gain knowledge of assistive communication devices, and as always, provide holistic care to support physical, social, and emotional needs to improve overall health, well-being, and participation.